This is Think Out Loud on OPB. I'm Dave Miller. The Oregon Health Authority is considering some major increases to fees for the state's supervised psilocybin program. The draft rules would also eliminate discounts for nonprofit service centers and some facilitators. These changes would come when many psilocybin service centers are already struggling to get by. A third or so have closed since OHA began issuing licenses in 2023. We'll talk to a founder and CEO of a center in Eugene in just a few minutes. First, I'm joined by Angie Albee. She is the manager of the psilocybin services section at the Oregon Health Authority. It's great to have you back on the show.
Thank you.
It's been roughly 3 years since the program was fully started, fully set up and operating. What strengths have you seen in that time?
Yeah, so first of all, it's incredible that over 22,000 people have been served under Oregon's model and served relatively safely. We say that because we've only collected data in 2025 with very few adverse events. That's a huge strength, as well as, obviously a lot of people working towards social equity plans to help serve those that might not be able to afford services. We've had incredible strengths in creating the nation's first data on regulated psilocybin services in Oregon. So we now have our OPS data dashboard published, and we're, really providing for all members of the public opportunities to see how we're doing with licensing, compliance and regulatory work, safety data, also who's providing services and who's being served. And so that's been really incredible to see that work, be published and come to life. And in addition to that, we also have a lot of international interest. And so for those partners that would otherwise not be able to access our data dashboard, we've created opportunities for them to see that through an archive. And so that's been incredible work. And then there's more work around the expansion that the Oregon legislature has made to our statutes that have created opportunities for facilitators under what's called dual licensure.
Right. What happened recently? How has the legislature expanded the program's scope in the last couple of years?
Yeah, thank you. So in 2023, Senate Bill 303 was passed, which was the data collection and reporting bill. And so I mentioned the data dashboard and what it contains. That work has created an opportunity to really publish data and collect data and evaluate. From there, we've also seen changes in 2025. We had House Bill 2387, which created the dual licensure provision. This allows for licensed facilitators who are also licensed under certain boards in Oregon to provide health and behavioral health services while they're preparing clients for psilocybin experiences and the afterward integration sessions to help support them.
Is this part of the sort of the medicalization of the program, if not officially, then sort of in spirit? I mean, I remember in the past when we would talk about the program, and I would sometimes hear people saying this is a therapeutic program. And I remember getting pushback, people saying, no, it's actually not technically a therapeutic program. This is supervised. There's a difference. But when you're talking about dual licensure and people who are licensed therapists or mental health professionals of various kinds, being able to, as say a licensed clinical social worker or other kinds of mental health professionals, do this work, does that mean that there's been a kind of a shift in the way the state is thinking about this program?
No, so the statute still remains. Clients can come through the door for any reason. It doesn't have to be due to a diagnosis. What this does is it allows for opportunities for safer screening and assessment in the preparation. Maybe you have folks that come in the door with complex diagnoses. Maybe you need additional support in the integration sessions. So to support them and, help them work through some issues and integrate their experience. So this actually provides a little bit more energy around the preparation and the follow-up work. It does create opportunities, though, to integrate this model into the healthcare system. And that also opens up opportunities for billing under the current structure. But there may be clients that don't have those complex needs. And so a licensed facilitator would not have to be dual licensed. It just creates a little more flexibility so that we can continue looking at safety and ensuring that clients have what they need to go through the experience.
So let's turn to the proposed rule changes, one of the big reasons we wanted to have you on today. Can you first just start by describing the process? I mean, who's on the committee that proposes new rules, and what kinds of guidelines or prompts are they given?
Yeah, so I'll explain our rulemaking process just very high level. For listeners, this might be important as well. Every year we do rulemaking, and we start with the Oregon Psilocybin Advisory Board, who makes recommendations to our agency. We take those recommendations. We have public listening sessions where members of the public can provide their feedback. And then we start drafting any changes to our proposed rules for that year. We also look at investigations. We are a regulatory, section. It's our responsibility to keep people safe and to ensure that those minimal requirements are in place and being followed. And so, we'll look at those, and then we'll draft the rules, and then we'll invite Rules Advisory Committee members to discuss those proposed rules, which we just completed. Then we will look at those revised rules again and prepare them another version for the public comment period, which will be September 1st through the 21st.
One of the headlines for the proposed rules as they stand now is the doubling of fees for service centers and facilitators. Why such a potentially steep increase?
Yeah. So when the Oregon Psilocybin Services Act was passed by Oregon voters in November of 2020, it established a psilocybin control and regulation fund. That fund only receives revenue from fees and from a small percentage of psilocybin tax revenue when service centers sell products to clients.
Meaning fully self-funded after a little bit of money from the state to set it up.
Yes.
So no lottery money, no income tax money. The system has to pay for itself.
Absolutely. So that's what the statute established and created. And because of that, the only way to keep up with rising costs that are outside of our control is to ultimately increase licensing fees. And, I do want to say we acknowledge the disproportionate impact that this could have on especially those folks that qualify for reduced fees, low-income, veteran, and nonprofit applicants, and we acknowledge the challenges for businesses, but we really have no other option legally.
Can you give us a sense for what the numbers behind what you were saying at the end there, the challenges for low-income facilitators or nonprofits? What would those people or places be paying now? What are they paying now, and what might they pay if this rule goes into effect?
So currently in place, licensed facilitators pay $2,000 annually for their license. And if they qualify for a reduced fee, then it's $1,000 per year. For a service center, manufacturer, and laboratory, it's $10,000 annually. And for a reduced fee for service centers and manufacturers, it would be $5,000.
Please.
Oh, go ahead.
Well,
and so the proposed rules double those fees and eliminate the reduced fees.
Noah Heller emailed us this morning with a question for you. He said, why don't psilocybin training programs pay licensing fees? I have a friend, he said, who paid almost $15,000 to become a psilocybin facilitator, but never found gainful employment in the industry. The for-profit training program got millions in tuition dollars from a lot of Oregonians like him. What's your response?
Yeah, great question, Noah. And thank you for that. We don't license training programs. According to the statute, we evaluate and review the curriculum for training programs, but there's another state agency in Oregon, the Higher Education Coordinating Commission, that has regulatory authority over career training schools and degree granting programs. So we are unable to charge a licensing fee because we don't license and regulate training programs.
You do license labs, and in the coming years, I think not until 2029, a lab licensing fee increase would also go into effect. The head of the only current lab in Oregon right now, Rose City Laboratories, told the Oregon Capital Chronicle in a recent article that his lab could stop offering psilocybin testing in 2029 without some kind of regulatory change. If something doesn't change and this goes forward, could there be a state psilocybin system without a state licensed lab? Could it exist?
The Oregon Health Authority doesn't change or modify the laws. That would have to happen through the Oregon legislature. So if the Oregon legislature determined to make changes to the statute, then of course we would implement those.
But under the current statute, could could somebody go to a licensed center where there are facilitators and ingest psilocybin if that psilocybin hadn't been tested by some kind of accredited lab?
No, so there is the licensing structure for laboratories, and each license type, the 4 license types, must be licensed in order for this model to work.
I mean, this gets to the biggest picture questions here. I mean, because this seems like a kind of downward spiral. The system is expensive for everybody, for trainees, to get your license to be a facilitator, to be an operator of a service center, to run a lab. And that means that it's expensive for people to go to these places as clients. And so some of these places are closing down, which then, because of the system you were describing earlier, as set up by voters and the legislature, it means that your agency gets less money to run the system, which means you have to raise fees, which then makes everything even more expensive. It just seems like a kind of a downward spiral that it's hard to see a way out of from the outside. You're on the inside, though. So am I missing something?
You know, I think what I would say is the future of this model really rests within decision makers and Oregonians. Oregonians pass this model through a ballot measure, and the legislature can make changes to laws. And so I think that truly it's the future of this program and the solutions to ways that this model could become more sustainable really ultimately are there. And also with the Oregon Psilocybin Advisory Board, the statute also directs them to think about solutions for long-term sustainability. So our hope is that there's a collective partnership where, there's really opportunities to look at ways to create sustainability for everyone under this model.
What are some of those possibilities? I mean, I don't, not to put you on the spot, and you're saying this relies, ultimately the decision making would be either Oregonians at the ballot box or lawmakers in Salem, in consultation with advisory boards and committees. But are there obvious solutions that actually could fix this?
Well, first of all, the Oregon Psilocybin Advisory Board, we just had a new cohort appointed, and they didn't have recommendations for long-term sustainability for this year. And as you know, we have a long legislative budget process ahead of us. The Oregon Health Authority does not have a proposal for an alternative revenue to support this program.
I'm imagining they're just running around with their hair on fire trying to figure out how to patch an unbelievable budget hole for Medicaid. And so psilocybin is not the top of OHA's list right now.
The healthcare of all Oregonians it's so important for us to think about that larger picture. And, for specific to psilocybin services in Oregon, Oregon Health Authority, we're a regulatory program. We focus on the safety of clients and of the public health and safety of all Oregonians and people even traveling into the state to access services. And so when we look at that larger trajectory, we just continue to align with those overarching state healthcare system goals and public health goals and continue to look to decision makers to help support providing solutions.
When Oregon pioneered its program not that long ago, voter passed in 2020, eventually, rulemaking and then set up in 2023, other states like Colorado and New Mexico were looking to us for ideas about what to do or absolutely in some cases what not to do. Now that we're not alone, now that other states have set up their own programs, are there things that we can learn from them?
Absolutely. I think any kind of implementation of policy is an iterative process where you're learning, you're incorporating what you learn. The challenge for states is every statute is so different that we'll continue to learn from one another. We'll continue to meet and collaborate and share updates. And I think that we also have to think of these models that are statewide as a reflection of what those states need or what they want, for example. And for Oregon, this model is reflective of the Oregon voters' will. And in Colorado and New Mexico, it's reflective of of their states. And so I think that when we think about it in that way, we think about the larger collaboration with all partners in the state of Oregon to really determine what comes next for this program.
Angie, thank you very much.
Thank you.
Angie Albee is the manager of the psilocybin services section at the Oregon Health Authority. This is Think Out Loud on OPB. I'm Dave Miller. We've been talking about proposed increases to licensing and other fees in Oregon's supervised psilocybin program. Kathy Jonas joins us now. She's the founder and CEO of the psilocybin service center Epic Healing Eugene, and she is a licensed facilitator herself. Kathy, welcome back to the show.
Oh, thank you so much for having me.
Can you remind us how you set up Epic Healing Eugene, what you see as your niche in the supervised psilocybin ecosystem in Oregon?
Thank you for the question. So we were the first ones licensed, and with my mental health background, I really wanted to create a program that was meaningful and would help people sustain long-term gains within the non-medical model and non-directive model rules that we had. So we are a very small service center. We just have 2 rooms. We usually just open up this service center for one person. Many service centers will rent out rooms. We decided to not do that and have a small core staff of facilitators who are, just part of our team, and not to have too much outside facilitator involvement unless they were actually hired within our program. And we created a extensive long-term care support model. So we offer 8 personal groups a month. 2 of those are ongoing preparation groups and ongoing integration groups 2 times a month, as well as personal growth groups, such as a trauma and transformation group. And then we offer all the individual support services, more preparation and more integration than what is required by the state guidelines. So every client that comes to us receives about 13 hours of support, and including their administration session, that's their actual psilocybin session, as well as all these ongoing groups of support. So we tried to make ourselves stand out in that way. So when people come, they really do get a lot of supportive services for what we're able to offer.
I remember when we first talked, you and other new psilocybin service centers said, wow, there's been so much interest. We've got waiting list, people calling us from all across the country. What about now? How is business?
Business, of course, started out as a big boom. We had thousands on our wait lists, and we're very small service centers, so it was impossible to serve that many. And then there's been an ebb and flow in the business, and now it's, more than a trickle, but at times it's not very much to keep things going. We, again, feel like we made a commitment to all clients that signed up for services that we would continue to offer our ongoing groups of support, which we do. But our costs are really high. We're a very small service center, and it still costs us around $70,000 a year just to keep the doors open without any increased fees.
When a business owner says business is more than a trickle, that sends gigantic alarm bells in my ears. So I wanted to just ask you directly, Angie Albee, she's in the tough position, clearly we could hear, between state statute and the legislature and the economic realities of the program that voters approved. But do you see that the system as it's set up now, and with the fee increases that are coming. Do you think Oregon's system is sustainable?
I worry about it. I hope it's sustainable because we have seen so many people that are coming to us that have tried, as I said, everything, and they're really they're seeking this avenue of healing. And so we've seen tremendous gains and transformation in people, and people are saying this was a game changer for them. I hope that there's going to be long-term support to keep the program going. But of course, I worry about how many service centers are going to be able to afford the current costs of running the business, the ebb and flow in the market, the facilitators that are going to have to meet fee increases. There's facilitators making choices right now not to renew their fees because there's not enough work out there. Now, sometimes facilitators are very fortunate and they have a good sustainable business they're able to make, but most people in this field have to have another source of income.
Is that true for you as well? I mean,
yes.
So you
yeah.
and many of the people you know, this cannot be your only job.
Right.
Do you see a pathway forward for a supervised psilocybin system in Oregon? If something has to change, do you have a prescription for how it should change?
Well, what I'd hope is that we would be embraced in the mental health system somehow, and that we would be looked at as a legitimate modality for healing for people, and that there would be support to look at just the value of what we're offering to so many people that are able to come.
And somehow being in the medical system, you're saying that could lead to more income for the program and lower fees for facilitators, for the lab, and for people who are using your services?
I would hope so. Currently, if it's not funded and there's not a big plan for funding, and if service center owners and facilitators aren't given hope, I guess, at this point, that this is a sustainable career to invest in education to become a licensed facilitator and to take this track. I mean, it's so meaningful. This work is genuinely, so many facilitators consider this as the pinnacle of rewarding work to be with people in this deep, supportive manner. And I hope it will continue, but I think that there needs to be a bigger embrace of the program itself. To compare us to like a cannabis dispensary or something, just because psilocybin is a Scheduled 1, and so is cannabis at this point, that it's so much different than that because we're offering all the preparation and integration. I'm also a licensed clinical social worker. So, we can offer so much within this supportive program. We just hope that we get some more support in general to keep it going and alive. And I appreciate Angie's work and advocacy because I know she is in a tight bind and she's been a real advocate for us. Just fingers crossed that there's a future for us all.
Kathy Jonas, thanks very much.
Thank you.
Kathy Jonas is founder and CEO of Epic Healing Eugene. It's a licensed psilocybin service center. She is a licensed facilitator herself.